From fitness to fashion, from self-centered to service to others, from flower power to the power of technology, baby boomers have left their mark on every aspect of society today. Born between 1946 and 1964, the 70-some million members of the me generation changed how we view and live our lives. And they still do. Even as the youngest boomers near retirement, neither the group as a whole nor its influence show any evidence of slowing down, especially as they tackle the biggest quality of life issue many have tried hard to avoid: aging. Hello, and thank you for joining us. I'm Dr. John Whyte, Chief Medical Officer at WebMD. On behalf of WebMD and Capital Caring Health, I'm delighted to welcome you to this special program on what boomers want. There's a lot you need to know as you or your loved one gets older and needs different types of care. The good news is there are many more options available to you today. And over the next 30 minutes, I'm going to tell you about some that exist right here in the nation's capital region. Do you realize the American population is becoming older at a rapid rate? It's estimated that the number of adults in this country over 85 will more than double in the next 20 years. As we get older and our loved ones get older, our needs change. What we need in our 60s, 70s, and 80s and beyond is very different than when we were in our 20s and our 30s. The COVID pandemic has taught us the importance of staying in our homes and getting care in our homes. To fully understand what the needs are, WebMD and Capital Caring Health embarked together on a comprehensive survey where we asked people aged 50 and older how you want to live and where you want to live as you age and what you need to ensure you have a lot of quality living in those years. During this show, I'll present to you some of the most interesting findings of the survey. I'll also introduce you to several experts on aging. But I want to start off with a story. Let's meet David, who turns 80 this year. He'll tell you how he went from living on his own to eventually living with his family in a small town in Virginia.
It is nice to be with my family. In September, I'm 80 years old, so the point is to keep active, to keep things going, not to give up on what you're doing, and to stay with it as long as you can. Being with the family is a lot better than being in a home. I'll tell you that right now.
We split the chores around here. We've all got stuff that we do. I really love growing vegetables and flowers and stuff. My father loves it too, so we work on the garden together, and that's been really nice to be able to work on that kind of stuff together.
And then we have chickens, and so we have hens that are laying, have been laying for a year.
Because of the pandemic, we decided to start raising chickens, and he helps out with that. We have a great time. He collects the eggs sometimes, brings them in and cooks them up right away. So it's a lot healthier living.
This house was designed specifically for the three of us, so it actually works very well. It was designed as two separate apartments next to each other, so it does allow us the flexibility to be together, but at the same time have independence.
Several years ago, my parents were living in Florida, and they had decided that they were just too far away from my brother and their grandkids and everybody, so they wanted to come back to this area. My husband and I were already thinking about maybe having a piece of land here. We thought, well, let's let Mom and Dad live on it. They wanted to be here, we wanted the piece of land. So we all went shopping together, and we found this piece of property, which we really love. There was an old house on it, but definitely not livable. So my parents lived in an RV on the land for a while. About 4 or 5 months, though, after buying the property, my mom passed away. So my dad ended up being here alone. And it's the country. It's isolated. It was far from us. My husband and I at the time lived in Arlington, Virginia, about 3 hours away. So it was rough. He was very depressed after my mom died. He wasn't feeling well a lot of the time.
I've always had migraines, and my migraines are not pain. My migraines, I lose my eyesight. So I don't lose it for long, maybe 30 to 60 seconds.
He was getting some severe migraines, and he has the aura effect with them, where he sort of loses some of his eyesight, which can be frightening. So when he was by himself, he just did not deal with his health issues well at all. So we decided to be here because we did not want my father to just be that isolated. At the beginning of the pandemic, when we first moved here, he was in pretty bad shape. And again, we worked on a treatment for it, and I kind of pushed him to do it. It was not pleasant, but he did it, and now he's just, I mean, it's 180. He's so much better.
What are you making with it? With them?
I don't know.
Carrots.
Carrot casserole, and you're gonna eat it, and you're gonna like it.
There's no way. Surely not. Can't you put some meat in it or
No, I cannot.
But now I haven't had one for 3 months, so things are better. Things are better.
I think it works really well. It has worked really, really well. Part of the reason why it worked well is that we have the proper space for it. So we are together, but at the same time, Beth and I have our own 600 square feet space that's ours. And so it's very hard to get in each other's ways. Well, for me, having David with us, having my father-in-law with us, it's really fantastic. It's a great pleasure. And I think it worked for him too. And he doesn't have those 5 days of being alone, which is what for a couple of years we were doing when we were just coming once a week. I'm sure that has to impact his health positively as well.
I'm very grateful that we're all living here now. I think it's been such a wonderful experience, completely worthwhile for all of us, for our mental health in general, but then also for his mental and physical health as well.
If I knew of someone who was considering having their parent move in with them or them moving in with them, I would strongly suggest that they consider how much independence the new arrangement is going to afford the younger couple or the middle-aged couple, and also the older parent, in-law, relative that they are going to be living with. I think it's important for the younger group, but it's also important for the parent to have their own space.
The parent-child roles really do reverse at this stage. And he is very, very healthy, and he's very independent. I have been a little concerned about being in such a remote area. It is a bit of a hike if we had anything severe happen. I think for emergencies, I would rather be closer to Northern Virginia for that. But we've been okay, you know? We've been taking care of each other, and we've been careful, and his health is so much better now that honestly, it's not a terrible concern for me anymore.
And it's a beautiful area. You can go boating. I've got a sailboat, and we can go boating, kayaking. There's all kinds of outdoor things to do. I think I'm very fortunate. It's not just taking care of me. It's being a part of living with a family, and it's being a part of doing things with me. Beth and I have all kinds of chores around the house. I don't do those chores on my own. We do them together. And then she has chores that she needs help on. Even the gardening now that she's taken over, and the chickens, she still needs help for certain things. So you feel like you belong. I think that's a good feeling.
As you can see from this story, there are a lot of things to consider while you think about aging in place. For instance, what are your financial resources as you age? Nearly all adults over 50 expect to have some type of financial resources after they retire. Social Security is most often expected. But is that enough? Who's going to care for you as your needs change? Do you have any type of caregiver? 85% of respondents over 50 said no. Does that surprise you? Honestly, it surprised me a little. Where will you live your remaining years? 78% of respondents over 50 said they were living at home, and another 10% said they were living at the home of a family member. Do you have a plan? How's your health? Most people, 77%, said they were in good health, and most people were hopeful about their future health. Is that realistic? So let's be realistic. There comes a time in everyone's life when your health may not be as good as you think it is. So what do you do next? What should you be thinking about now? To help answer some of the questions, I've asked my good friend and partner on the survey, Steve Cohn, Chief of Communications, Marketing, and Philanthropy at Capital Caring Health, to join us. Steve, can you tell our audience, why did you decide to do this survey together? Didn't we already know this information?
Yes, John, we did, but we decided, WebMD and Capital Caring Health, that the onset of the pandemic was a reason to really survey, canvass Americans 50 and over during this period of time to see if aging in place issues were still in the forefront and what people were really thinking based upon everything that's occurred over the last year and a half. And we discovered that more than ever, people want to age in their homes and try to avoid, being moved out of something out of an environment that they're very comfortable in.
And we saw in David's story that even if it wasn't his own particular home, it was with family members. Was there anything about David's story that surprised you?
No, but it's nice to see that, I think he's a widower. Mm-hmm. And so what was David supposed to do? Maybe even in decent health, being by yourself is not an ideal situation. Being around family is always preferred, or most of the time anyway.
Mm-hmm. Some family members, maybe.
Yeah. But, David and his and daughter and husband really decided on a very nice solution. Mm-hmm. And, I think we see that more and more now with the baby boomer generation and their kids. Mm-hmm. And it's really, you could even call it back to the future because, prior to World War II, which seems like a long time ago now, but that's how most families tried to live, in the same home, multi-generations, or in the same block or general area.
And part of the challenge, though, in living longer is that, most of us develop health conditions. David's pretty functional at his age and healthy, but not everyone is. And they talked about, having a healthcare facility nearby. How do we provide healthcare in the home? What's available for seniors as they get older?
Right. Capital Caring Health provides a service called primary care at home. And by the way, we're part of a national community-based network of 75 organizations, not-for-profit, mission-driven, advanced illness hospice care organizations like ourselves. And so many of our sister organizations provide a similar service. Again, we call it primary care at home. You and I have talked about, I like to call it surround care.
Yeah, like surround sound, we were saying. Mm-hmm.
And so it's really allowing people like David to have a complete lifestyle service. Now, in most cases, primary care at home is provided to people whose illness has progressed and is considered serious. And it includes a medical team, a nurse, a physician, and a social worker to work not only with David, but also his family members who want to be involved in his care. So it's medical care, it's behavioral care, it's diet and exercise issues, and trying to make sure that the patient is getting the right combination of those, including meals delivered. It does allow for transportation when that's necessary, but also two other important things are prescription care and management. And we find often that people have not been getting the prescriptions that they need, or have been getting too many. So our primary care at home team really does focus on that. And then, of course, taking care of pets, which is a very important part of many families. And then the other element to primary care at home, which is very, very important for people, to provide peace of mind to the patient and their caregiver or family members, is we provide 24/7 phone access with a live member of the team. No answering service. If they have an issue at 3 in the morning, they don't have to call 911. They can call us, and a team member will be there at the other end of the line.
And it's often 3 a.m., it seems. I want to ask you about this concept of advanced illness care. You and I have talked about it, but how do we make people more aware of this? Here we are in the capital region where, we have these services available, but people often don't know about it or they don't think it's right for them. So how do we raise awareness?
Yes, well, especially, John, with folks who live in lower income communities who need our care more than probably the average.
Well, I want to ask you, because it sounds like those services could be expensive. So help our viewers understand, what's available to them.
Yeah, so we try to get the message out with public service announcements, and we're very blessed with the radio and TV folks in the Washington metro area who help us get that message out. We also talk to community-based organizations, local businesses, local associations, and very importantly, faith groups, because particularly among minority populations, there is a mistrust that's been around for a long time of the healthcare system in general, and a real reticence to having people come to them.
Sure.
Come to them to provide, in our case, medical care and lifestyle support. And so faith-based groups, we're working with a number of them at Capital Caring Health to come into communities like Ward 7 and 8 in Washington, D.C., which are very disadvantaged neighborhoods, to get people to become comfortable with the care that can really change their lives and extend their lives.
Sure.
And provide a better quality of life for folks who need it most.
Well, a lot of viewers may be hearing this for the first time. So where do they go for more information?
They can always come to capitalcaring.org, where everything that I've talked about is available. And also, they can call us on our care line, which is operated 24/7.
Well, thank you, Steve, for all that you're doing, all that Capital Caring Health is doing for our residents here in the capital region, as well as you mentioned, with your partnerships with groups around the country. Given the fact that our society is aging, you might be wondering if healthcare and social services can keep up. I know I'm wondering that right now. After a brief break, I'll introduce you to Ramsey Alwin, the CEO of the National Council on Aging, and I'll talk with her about the specific needs of people while aging in place. You will not want to miss it.
Capital Caring Health is one of the largest nonprofit providers of advanced illness, elder health, and hospice care in the country. It is committed to helping those with an advanced or progressive illness remain in the comfort of their own home, surrounded by loved ones.
Primary Care at Home is a team of people who visit folks who have serious illness, generally 65 and over, to take care of all their medical issues, social supports, and nursing needs at home. We're available 24/7 for live access and help keep them out of the ER and the hospital. It gives support and peace of mind to the patient, but also to that family member who's really concerned about their loved one.
Capital Caring Health is a national leader in providing advanced illness care to more than 3,000 patients each day throughout Virginia, Maryland, and the District of Columbia. If you're managing the medical and social needs of a loved one with an advanced illness or life-limiting condition, you'll find the support you need at capitalcaring.org.
Ramsey, thanks for joining us today.
Such a pleasure. Thank you for having me.
In our survey, we found that 8 out of 10 respondents said that it was important to be able to stay in their home as they age. Is this concept of aging in place one of your priorities?
At the National Council on Aging, we've been working since 1950 to help older adults stay in their homes. We've been quietly by their side, working to improve their health and economic security. And aging safely in your home is absolutely a priority for all older adults. We've been advocating, providing products, services, resources to help individuals and those caring for them to do just that.
And then how has the pandemic changed this interest in staying home? In many ways, I would think it actually increased people's desire.
The pandemic has shown a light on aging and aging in place. We haven't seen aging in the headlines like this forever. And it has all of us thinking about how we want to age. The tragic outcomes in institutional care and nursing homes has all of us thinking about what we need to do to make sure we can be cared for in our own home.
Well, let's talk about resources. So we know that on average, 10,000 boomers turn 65 every day. So I have to ask you, what are the abilities for the healthcare system and social services to keep up?
It's incredible, isn't it? And unfortunately, our systems are not prepared. They just can't keep up. And it's ironic because we've known since the day the boomers were born that they were going to be fortunate enough to age, and we could have, should have prepared as individuals, as a society, but we need to make up ground. We need significant investments and new thinking and innovation to ensure the health and economic needs of the older adults of today and the 90 million millennials that also will enjoy the gift of longevity have access to do so.
Well, why don't we plan on an individual level? Is it an attitude of, I'll get to that later? Is it, you don't want to think about it? What's the challenges? Like you said, we all know we're going to get older and need services, but we don't think about it.
We don't. We don't think about it until a crisis hits. When mom needs help, when a family member is trying to enroll in Medicare, all of a sudden there's an aha moment there. And we need to better maximize that. When we see opportunities to begin to think about those long-term plans, when other family members are going through it, we should start to think and reflect on our own long-term planning. So often we are denying our own aging, and that's hurting us in the long run. Really, aging well is about living well today as well. So thinking about your basic health and wellness, your nutrition, your exercise, and your money matters today can set you up for success tomorrow.
Well, what are the biggest successes that we've seen? And then I'm going to ask you, what are the biggest challenges that we still have?
Sure. Well, I think modern medicine is an incredible success. The breakthroughs in technology and medicine that's giving us more quality years with greater health across the board. We're experiencing the gains in longevity. I think that we have an opportunity to ensure that that's more equally shared. So one of our greatest challenges, I think, is ensuring that those new radical life extension technologies and medicines are equally shared.
What does radical life extension mean?
Well, there's some incredible innovations around the globe. Silicon Valley, and there are other hubs around the globe looking at different technological breakthroughs that can allow people to add additional years to life. Many say the average 10-year-old today is likely to live to be at least 100. And some say with different technologies, we could extend that even further to 150 and beyond years.
What does aging for seniors look like in 2030? Take out your crystal ball and tell our viewers, what do you expect will it be?
Well, I'm excited. I'm excited about all the possibility, the innovation from the private sector, the government reimagining its role. I think that older adults want and need to work longer, and they will continue to do so. They'll want and need to age in place and age safely in place, and they'll need the types of supports that allow them to do so. So I think by 2030, with the right type of attention that we've unfortunately received due to the pandemic, we'll see some game changers come to fruition that will change the way the boomers age and ultimately all of us.
Well, Ramsey, we'll have to check in with you in a few years and see if your crystal ball predictions were right.
Thanks so much.
Well, thank you for joining us today. How many of you are wearing a smartwatch? Any of you do a telemedicine visit last year? Well, coming up next, you'll learn about devices and technologies that can help people age in place, such as telemedicine and remote monitoring devices. But are people willing to use this new technology, and will it help them age in place longer with a better quality of life?
Capital Caring Health is one of the largest nonprofit providers of advanced illness, elder health, and hospice care in the country. It is committed to helping those with an advanced or progressive illness remain in the comfort of their own home, surrounded by loved ones.
Primary Care at Home is a team of people who visit folks who have serious illness, generally 65 and over, to take care of all their medical issues, social supports, and nursing needs at home. We're available 24/7 for live access and help keep them out of the ER and the hospital. It gives support and peace of mind to the patient, but also to that family member who's really concerned about their loved one.
Capital Caring Health is a national leader in providing advanced illness care to more than 3,000 patients each day throughout Virginia, Maryland, and the District of Columbia. If you're managing the medical and social needs of a loved one with an advanced illness or life-limiting condition, you'll find the support you need at capitalcaring.org.
Telemedicine helps patients meet with their doctor virtually through a computer or smartphone, rather than having to leave their house and go to the doctor's office for every appointment. You may have already tried this with your doctor during the recent pandemic. About half of everyone surveyed over the age of 50 said they had used telemedicine for virtual doctor's appointments before. That's a lot, and it means this technology is becoming part of our medical care now more than ever before. Still, a little more than 50% of people surveyed say they feel that telemedicine is less effective than an in-person doctor visit. Telemedicine does have a lot of benefits, such as access to specialists that may not otherwise be available. There's no transportation costs, and you don't waste time in a waiting room. Change is difficult for people, but embracing new technologies like telemedicine could really make a difference in how people age at home. Remote monitoring is a technology that allows doctors to see data from patients more often. Few people were willing to embrace certain types of remote monitoring, like monitoring of eating habits, sleep habits, body temperature. But the COVID pandemic is changing that. We need to explain why this helps improve your care without compromising your privacy. Emergency response is the leading type of remote monitoring that respondents aged 50 or older said they would most likely allow in their homes. But other types of remote monitoring could really help those aging in place with certain illnesses like diabetes or heart disease. As we get older and our loved ones get older, we need to embrace and seek out the technologies that will allow us to age the way we want to. More and more people are choosing to age in place, and it's more important than ever to learn as much as you can about new technologies, different types of living situations, and even anticipate your specific needs that will allow you to stay at home with loved ones. It's also critical to have a plan in place if you or a loved one's health deteriorates. I hope this program has got you thinking about what you can do to maximize both the quantity and quality of your years. To learn more about Capital Caring Health and its Medicare-supported at-home services for seniors, be sure to visit capitalcaring.org. On behalf of WebMD and Capital Caring Health, thanks for watching.
I'm Steve Cohn, Head of Communications at Capital Caring Health. You have heard today about the extensive survey WebMD and Capital Caring Health conducted nationwide on aging in place, about the attitudes of those 50 and over. These are valuable insights we want you to have. Plus, a listing of all the chronic illness and hospice services that Capital Caring Health provides to all who need us, regardless of ability to pay. To get your free copy of What Baby Boomers Want, go to capitalcaring.org/boomers. As we like to say at Capital Caring Health, you are not alone anymore.